All right, hello. I'm Dr. Aaron Rogers, an ear, nose, and throat doc upstairs, one of the docs overseeing advanced hearing centers. And this is
Dr. Stacy Pickelman.
basically we wanted to give a 1 or 2 minute little rundown on how hearing loss might accelerate cognitive decline in some of our patients.
hmm So, research has shown that untreated hearing loss may affect your cognitive decline. For those with just even a mild hearing loss, you have a three times more likely chance of having cognitive decline. My question is if we treat the hearing loss sooner rather than later, are we able to reverse some of that cognitive decline or at least slow down that progression?
By most of the studies that I've seen, and that, by the way, get emailed me every week at least, a new study or new correlation of hearing loss to dementia development. By most of the studies, hearing loss seems to accelerate cognitive decline about 20%, which is amazing. That sounds like a little bit, but that's really one of the most important tools that we have to combat dementia progression or cognitive decline seems to be restoring the senses, whether it's restoring vision as much as possible with a vision impaired person or restoring hearing as much as possible with a hearing impaired person. For instance, most of the drugs now, which there's only a couple, the drugs that are used to treat dementia don't even have a 20% success rate. And if we can get folks who have a hearing loss the right tools, we can definitely see improved interactivity with others, which further stimulates the brain on a daily basis to keep folks sharp.
Yes, and so at our practice here, we have a cognitive screener that we have all of our patients take free of charge, and it gives us an idea of where they are compared to their peers. The interesting part is those who treat their hearing loss, for the majority of them, we were able to actually stabilize their cognition scores or even improve them.
This is a little screening test that we can do basically to any of our adult patients. It takes about 15 minutes or so. You kind of use a little dedicated computer device, and it's essentially, I like to say, it's sort of testing your mental reflexes. It's not testing how smart you are or how good you are at trivia, but it's testing your ability to kind of have a real short order memory function and short order sort of neural reflexes. It is a type of neurophysiologic test that might be done by a neurologist or a neuropsychologist in their office. That can be done at our initial visit, or sometimes it's done at even hearing aid follow-up visits. I think you're doing sometimes several of these
Correct.
tests for patients over a year or two's time. Is that right?
Correct. My goal is to have it completed every 6 months. Ironically, we have a few patients who choose not to treat their hearing loss, and their scores have kept going down a couple points each time. So those are
But those patients still keep coming back to see you, Stacy.
for our cognitive view, yes.
All right. Anyway, it's an interesting topic, and it's sure to only expand, I believe, because really we have, for one, we have a population that's aging where this is becoming more and more important to more and more people. And for two, we really don't have any other useful treatments for cognitive decline at the moment. So anyway, we look forward to seeing you in the office. So if you can come in and have a hearing screen or an ear visit with one of us, and we will get you all taken care of. Thank you very much.